At the core, MyIHM is comprised of 5 basic sets of capabilities: track, connect, shop, budget, and learn. Track is about keeping track of one's health and wellness over time, which could involve the use of biometric devices or simply reminders of periodic checkups or daily medications. Connect provides electronic modalities similar to Skype to enable individuals to interact with their providers, whether it is a primary care physician, nurse coach, pharmacist, or personal trainer. Shop uses one's personal health profile as a filter to automatically select relevant products and services on your behalf. Budget helps you effectively manage your health-related spending. And finally, Learn brings together personalized health content from a wide range of trusted sources over the Internet. Together, these 5 sets of capabilities help create a truly one-stop experience destination, regardless of one's health status. Let's walk through a few daily scenarios between 2 individuals, Diane and Dave. These scenarios will help bring to life what we think a future integrated consumer health experience will be like. Diane Ritchie is a healthy mother of 2 and a caregiver for her 70-year-old father. Here is Diane's high-level dashboard, the first thing she sees when coming to MyIHM. Since Diane has a family history of hypertension, her blood pressure is always closely monitored and highlighted. Diane recently signed up for a marathon training program. The window in the middle shows her training data summary. My Events reminds Diane what she needs to attend to that day. My Recommendations shows personally relevant products or services. And finally, My Feeds displays relevant conversations and postings from Diane's social networks. Note that MyIHM doesn't introduce any new social network. Instead, it taps into the existing social networks Diane is already part of and filters through relevant conversations so she can access everything in one place. Let's go to the exercise section. Here we see a bit more detail about Diane's marathon training, her goals, and her actual data. She can opt to share the data with her training buddies, in this case, Mary, who lives in another city. She can match her data against Mary's to see how they compare. This is one way to keep her motivated and competitive over the course of the extended training program. One morning, Diane gets up and finds herself extremely exhausted. She comes to MyIHM to learn more about the potential causes for her problem. This may look like just another Google search, but it's not, in 2 important ways. First, the search results are not just a function of the keyword, but a result of Diane's entire health profile. Second, as you can see, there is an embedded link that allows Diane to initiate a situational chat session with her provider, which in this case is her health coach, who can see exactly what Diane sees. In this scenario, her health coach is able to help her choose the right nutritionist. In the event that Diane needs to select a new provider, MyIHM brings together all of the information about providers necessary to help her make the right decision, including quality, cost, and other patients' experiences. Information like this is becoming increasingly available, but it's scattered all over the Internet. MyIHM makes this information usable and available at the point of need. Once Diane has her care team selected, she can use MyIHM to schedule appointments or conduct virtual interactions as needed. As mentioned earlier, Diane is a family caregiver for her 2 kids and her 70-year-old father. This is Diane's family dashboard. Here's a closer look at her dad's status. As you can see, there is a note from her family health coach about her dad's body weight, which has been trending downward over the past couple of weeks. This could be an early warning sign of something serious. Following the advice of her health coach, Diane decides to schedule an appointment for her dad to have a physical checkup. Let's fast forward to a few days later, after Diane's dad went to see his doctor, Dr. Haling, who ordered a number of tests, including a CT scan, as shown in the event trail. As it turns out, her dad was diagnosed with an early stage of lymphoma. This is obviously a huge disruptive medical event for the family. With this health status change, Diane and her dad can now use MyIHM to help navigate through the system and get educated on how to best handle their new medical situation. There is a new embedded cancer management tool that brings together personalized, trusted information for new cancer patients. Another unique feature of MyIHM is Shop, which automatically selects products and services based on Diane's current health profile and brings those deals to her. It has also incorporated the concept of life bundles, which includes recommended packages of products and services based on specific life events, such as caring for aging parents, which could drive her purchasing decisions in the weeks and months ahead. Dave is a recently diagnosed type 2 diabetic, busy professional, and constantly on the move. So, for Dave, having MyIHM on his iPhone is absolutely essential. Taking his doctor's advice, Dave measures his blood sugar levels the first thing every morning using a glucometer. He enters the readings through his iPhone, which automatically uploads to the remote server. He can see the trending chart on his phone. Based on actual data patterns, he may also receive pointed questions like how he feels or how much sleep he is getting. The timing and the type of questions presented are driven by evidence-based decision rules. His answers to these questions then become part of the basis for personalizing future interactions. When Dave travels to a new city, he can count on his geo-enabled iPhone to locate a diabetic-friendly place for lunch, for example, using an integrated capability similar to Yelp. He can also use his phone to take a picture of the food he eats. MyIHM is capable of recognizing common meals and can automatically extract nutritional information to populate in Dave's food diary. This way, Dave can maintain a detailed history of what he's been eating. Occasionally, when Dave comes to his MyIHM web dashboard, this is what he sees. Among other things, the dashboard highlights how well Dave is complying with his care plans. It also shows how much more financial incentive he might be able to receive from his health plan if he continues to improve his health behaviors.